Good afternoon, and thank you very much for joining us. I think most of you were at the morning presentation, but I won't assume. My name is David Merriman, and I am a member of the Executive's Office, and I'm here today to share or to help have a discussion about Pay for Success and child welfare. I think a great number of you were at the morning presentations where we reviewed the RFR for the Pay for Success project. So we're going to try not to get into that at all. I think we've talked enough about how Pay for Success works and what the request for a response is what it's structured to give us. And so we want to get quickly to the child welfare presentation. We will pass through a few statements on kind of where we are as it relates to our process. And then this will again be a tag team presentation with Caroline and Pat jumping in at times. So if you can't hear us or if you can't hear one another, please just ask for a question to be repeated or ask us to speak up. So we're going to go ahead and jump into the presentation. Again, I promise this will be a quick overview of where we are. We have recorded this morning's technical assistance session, and that will be posted on the website. So if you weren't able to make it in the morning and you'd like to know more about the RFR, look for that to be available for anybody to watch. Just a quick overview as to where we are right now. So we've already kind of passed through the community education, the landscape analysis, this process advice, and we're now to the technical assistance for responders. And I think now that we have the RFR out and we're looking at it, we're squarely into our process and moving forward. So the reason that we are interested in having a discussion centered on child welfare and Pay for Success is that during the landscape analysis, we did see that there's a high feasibility of a connection between those two areas, largely because of all of the board and care costs associated with child welfare. Our county costs, we understand there is reimbursement, but at the end of the day, that's a cost that primarily comes from and comes to us. So it is one of our areas where we see a high likelihood of being able to find a service that can save us money. So that's the reason we are having this discussion. There are other areas that we understand also have the potential to be Pay for Success contracts or projects. This is just the one that we're honed in on at this point. We're going to have a very brief walkthrough on the landscape analysis, and just to talk a little bit about who we talked with and how that went. So I'm gonna ask Caroline to share just a little bit of information about what our analysis looked like.
Right. So we did with the landscape analysis. I know we kicked off with a series of public meetings that many of you were at, and so now it's starting to have some familiar faces. And then we spoke with a combination of funder partners as well as folks that reached out to us from those provider meetings, as well as sort of looking at the county budget to see, okay, where are some high areas where the county's spending a lot of money, where we can look to reach out to providers and preventative interventions in the community. And so we reached out to several people. Some folks also reached out to us. We didn't speak with everybody by any means, but the folks we spoke with, about 50 or 60 individuals that span providers, funders, evaluators, some county department heads, and other community leaders, gave us some insight that, okay, one of the areas that might have a lot of potential is child welfare, both because it's such a high cost for the county budget, but also because there's such a rich array of providers in the community already that could be able to succeed under this new financing construct. Some other areas we looked at were also homelessness, mental and behavioral health, workforce development. And so those are some of the other areas we considered as well. Again, not in any way to exclude areas or not, but just in terms of what we saw as a combination of both a wealth of existing providers that could take advantage of this contract, as well as sizable county budgets that could potentially be affected with this types of program.
So as we move forward, and as we stated earlier, this is an area where I know the executives completely committed to the child welfare system, wants to support it, wants to see it improved. I think we have an outstanding leadership team at the Department of or Division of Children and Family Services, and so there's the right team in place. And I do know that we need to have the proper intervention presented for us to find an opportunity. And so what I have here, and I apologize for how busy this is. I know that it is very busy, but this is simply the continuum of evidence of effectiveness. This is a CDC table that really just talks about the continuum that exists as to evidence-based programming, if you will, and whether a program kind of spans from a well-supported program to something that has potentially harmful impacts. I simply present this to say that we understand there are a lot of great interventions in this community, and they mostly fall probably somewhere, I would assume, from this span forward. And we understand that many of those programs they may lack the research to support them as being a truly an evidence-based project, and or they may not have the resources to implement their program to fidelity, and so they possibly they probably wouldn't be able to present themselves as that. That's something we're aware of, and it's something that we do not want people to have their lack of implementation to fidelity at this point stop them from presenting proposals. We don't want folks to say, well, we only have to see this final category for us to be considering a project. That's not the case. I did present earlier that we are looking for evidence-based interventions, and I think we would like to find that. We would like to be able to shop to investors that there is a high likelihood that that project, if implemented as presented, will have the outcomes that are associated with it. And I think the farther along in this spectrum that we go, and the research that accompanies those projects, probably the higher likelihood that we'll get an investor to take a look at it. But it should not preclude anyone from applying with a program that doesn't hit the evidence-based status. So what I'd like to do is I'm going to turn this over to Caroline to talk just a little bit about some of the key characteristics of Pay for Success. I'm going to actually step out. I'm going to grab copies of this presentation, and we'll have it available for the end of the meeting. So
great. And so I'll pass to Pat afterwards.
Yep, I'll be right back.
So I know many of you were here in the morning. We just wanted to give a little bit of a framework, theoretical base for what the county was thinking about when we launched this RFR, and what we think about when we consider programs and whether or not they may be a good fit for Pay for Success. So I think the first piece and the most critical piece is government leadership, which I think we have here at the county, and you've seen by the demonstration both of interest with the request for responses, but also the county executive notifying in the Western Reserve Plan that they are committed to moving forward with this. At the end of the day, this Pay for Success is a government contract, so if government's not interested, it'll be pretty hard to get one of these done. The next piece is significant unmet needs and targetable populations. This morning we talked a lot about having a clear insight into who can you serve with this intervention. And I think that we need not only a clear idea of who you can serve, but also, are there many individuals? Is this a problem that 20 people have? And so maybe we can serve those 20 people, but Pay for Success may not be the right tool to do so? Or is this a problem that is large scale and that really we could benefit from coordinating services across multiple providers to address a target population that might be in the hundreds or even the thousands that's currently not being met? And so for child welfare, I think Pat will speak with you a little bit about some of her ideas as to what those target populations could look like from the DCFS perspective. The next piece is credible data. Are there government data systems in place that can be used to track outcomes on an individual basis? And so sometimes in other areas we look to, for example, the justice system, whether or not there are data systems in place that tell whether or not somebody has recidivated, gone back into jail. Can you rely on those data systems to track individual outcomes reliably? There could be other examples in homelessness with HMIS or other data systems, but you really want to have credible data systems in place and not feel like you're going to have to create whole new ones in order to make this project work. You want to build on hopefully already existing administrative data. The next piece, very critical, interventions that work. And David put up the sort of complicated slide before, but these are performance-based contracts at the end of the day. And investors will be repaid based on whether or not a provider is successfully able to meet outcomes. And so having, particularly with these early projects, confidence that whatever intervention or project we decide to build a pay-for-success around is actually going to work is a pretty big deal. And so either the presence of an independent evaluation or some insight into the actual whether or not the program has been successful in the past is going to be really key. Additionally, are the service providers scalable? We talked about having a potentially coordinated group of service providers that could be at a small level in different communities. I think ultimately these projects are about growing existing capacity to serve a need that has not been met before, and so it will be key for providers to be able to grow to meet this increased demand if they're given the resources to do so. So if there's one provider that's in one community and has a wonderful program but isn't going to necessarily be able to scale to serve an additional 100, 200 folks, Pay for Success may not be the right tool for that particular project. We spoke about safeguards. Very important. What if the project doesn't work and goes wrong? Are these individuals going to be left on the street? What are the safeguards that are in place to ensure that our community members are still getting services and not being denied care, or and there's no harm done to them? And then the last piece, which is also very important, is cashable fiscal savings for government. Is the county, in particular, could also be other levels of government, but for Cuyahoga, is the county seeing insight into cashable fiscal savings for them within the 4-year time frame of the project? Are there going to be either marginal costs that are not incurred because you have redirected folks away from prison or from a hospital or what have you, so are there cashable fiscal savings there? So that's a little bit about the framework that we think about for Pay for Success as we consider what could be a good fit for the program. There's also some pieces where, some challenges for Pay for Success implementation where some of these, the projects start to break down a little bit. So, for example, if you have an intervention but outcomes are really hard to track, maybe you think you're really successful, but there's no government data right now to show it. There's no databases externally that can actually show that you've made progress against a set of indicators. This may not be the right time to pursue a Pay for Success contract. It might be the right time to think about, okay, what do we need to get those systems in place and move towards that. But at this point, Pay for Success is really looking for those interventions that already can tap into existing databases. Unproven or mandatory programs, I think at this point, Pay for Success, David mentioned earlier this morning that for these initial pilots, we really want to build off of something that we know is going to be successful. So we'll have a chance to see if the construct works and can move on to other areas with more innovative programs. So if you have a really cool idea for a program, but it hasn't been implemented yet, probably not the best project to build a Pay for Success around, because we want the initial pilots to have a demonstrated track record of success. And again, with mandatory programs, we're not looking to dismantle the safety net in any way. And so if your programs are for safety net programs, they're not right for Pay for Success implementation at this point. It could be that the interventions are not scalable. You could have an intervention very successful in one community that's not replicable and maybe shouldn't be replicated to other places. It just may not be right for Pay for Success at this time. If there's no fiscal savings, because the county is sort of banking on having fiscal savings as one way that they can tap into to reimburse investors and reinvest in the project, the county needs to be able to see some cashable savings. And so I think given a choice between two projects, they'd probably go for the one that does show fiscal savings at this time for these initial pilots. No government champion. If there's no procurement process or no will from the government, can't get that government contract done. And then the last one is lack of a proven intermediary. For some, not for all, but for some projects, you might require multiple service providers. And if there's no coordinating entity or entity that's able to sort of bring everybody together to move towards measuring the same outcomes, it might be really difficult to do a Pay for Success around that project in particular. So that's another consideration to have as well. At this point, I don't know.
Yeah, I don't know. At this point, what we committed to not doing a long overview on the process. We're here to really hear from Pat and hear about child welfare. related issues. And so let's just, I'll turn it over to Pat. And so you are, here's your down arrow up here.
Yep. Got it. Hi, everybody. Nice to see lots of familiar faces and some new ones. So there are plenty of unmet needs in child welfare always. That's, I guess, one way to look at it. So what I want to do today is really just give you a snapshot of 5 different areas familiar to, I think, most of you in this room, where opportunities exist for good ideas of ways to bring some of these programs that are very promising to bear on our need for success in our child welfare system here. Before I tell you about those 5, though, I wanted to remind you that there are a number of places where you can access public data about the child welfare system and our families here in this county. And they are here, and David's going to be giving everybody a hard copy of this, right?
Yes.
Yeah. So some of you may be familiar with these, our website, where we post what we call the flash report every single week, so that you can see big categories: how many kids are in care, where they're placed, what custody status they're in, those kinds of things. And as well as monthly statistics, they're much more in the nature of caseload information, some outcome stuff that we post on a monthly basis. And then you can look to 2 statewide websites, one through ODJFS with different county profiles if you want to see us in relation to some of the other counties in the state, as well as PCSAO, which is our Public Children's Services Association of the 88 counties, has a fact book. They're about to actually publish a brand new one, again, with some county-to-county information that might be useful to you to have a look at. Okay. So those 5 things that I wanted to throw out there for you as, again, samples, snapshots of areas of need. The first 3 really have to do with how long our kids are staying in out-of-home care. Our overall number of kids in care these days is for us, modest. I mean, we have 1,800 or so, and as many of you know, in years past we had far more than that. However, it's a big challenge for us in ensuring that those kids don't stay too long in care. Some say as you take fewer kids in, they have, more significant problems and tend to stay longer, perhaps. But we think there's a lot of opportunity to do better at how long kids are staying in care. Obviously, kids who stay too long in care have many negative outcomes as kids and as adults. Furthermore, it's the law to not let kids languish too long in care, and that's important to us. It's best for kids to get them home quickly, and if they can't go home, to get them into another permanent family. So we need to make sure that we pay attention to these issues. Some areas we could look at are kids who stay in care for more than 12 months. The general standard in child welfare and the law is that if you keep a child in care away from their parents for any longer than 12 months, you require the permission of the court to do so. And you have to be able to make a case for why that child is staying longer. So that's our benchmark there. Kids who stay in care, if you can believe it, for more than 10 years. In our county, we have some of those kids, and needless to say, it's terrible for kids, it's very costly, it's an outcome we really don't want to see at all. Adoptions. When we terminate a parent's rights, that is because it's our intention to find another family for that child. If we're going to take away the one that they started with, hopefully for very good reasons, that child needs another family. So making sure that kids don't wait too long for that second permanent family is also a very key area for us. The 4th example I'm going to give you some more information about is our kids who age out of care, which is something that happens typically after a long stay in out-of-home care. Again, a heartbreaking outcome. We remove a child from their family. We do not succeed in getting them back home or into another permanent family. No child is going to do well with the government as their parent. And in that transition from childhood to adulthood, it's a terrible thing to be on your own. And so this is a main concern as well. And then the last example we'll talk about is kids. We want to see more kids placed with relatives. We know that kids placed with relatives will have more stability, will have better outcomes in general, and if in fact they do not go back home to their family of origin, they're with their family. So there are many reasons why we want to see kids, if they must come into care, be placed with relatives when we can find good relatives. We're not placing enough kids with relatives these days, and so that would be another area of focus for us. So let's dig a little deeper into these. First of all, the question of timely reunification, and this chart gives you some data about the kids who exited in the last year, roughly, to go back home to their family of origin. Only 58% of those kids did so in less than 12 months. As you can see, we've got big percentages of kids who are going back home 12 to 15, 15 to 24, and over 24 months later. And so this is a concern for us. We're glad that 2/3 of our kids who enter care do end up going back home to their families. But we also know that we need for kids to get home more quickly. It's a balance, however. If you send kids home too quickly, their families, their parents perhaps have not fully dealt with the issues, quite often mental health, alcohol and drug related issues that brought them into care. We do not want to see kids cycle back into the system. So this is a bit of an art. That 12 months point, by the way, is our federal measure that we are held accountable for. And the target we're seeking is for 75% of our children who come into care to reunify within 12 months. So you can see we're a ways off of that at 58%. Okay, let's look at the next one, which is those long stayers I talked about. And this is a snapshot of kids who are currently in care and have been for a very long time. I like to think that this population of kids represents the tail end of what was a very large number of kids in care 10 years ago and around that time. We had a very large population of kids, over 6,000 kids in care in those years, and so perhaps this number will shrink over time. But right now, it worries me a great deal that these kids, in fact, never got out. And so this is really important for us to pay attention to. There are 81 kids we're talking about in this group, and most of them are, I'd say more than half of them anyway, yeah, are 17 or over, and there's some 19 and 20-year-olds in there. I think you all know that we can keep a kid beyond their 18th birthday if they're in school and they want to be in the system still. So we still do have some of those kids. 3/4 of these kids are African American. Another big problem, and by the way, another reason we want to see more kinship care so that our kids can be with their families and in their own family culture. And most of these kids are in permanent custody. We took them into permanent custody. We intended to find them another family, and we failed. So this is a very sad situation. Now, many of these kids are challenged with significant behaviors, mental health issues, some very severe developmental delays in some cases. Many of them have experienced multiple placements by this point in their lives, which exacerbates the challenge of finding a permanent family for them. But I don't want to see any of these kids ever, let alone spending 10 years with us, so this is really an area of grave concern. This next slide is a profile of those kids who age out of care. And this slide looks particularly at our highest risk group for aging out, which are children who come to us between age 12 and 14. They are the kids who currently and in recent years are typically the ones who end up staying with us and not getting back home or getting to a second family. And we chose this group of kids too from 06 because they are the kids for whom an exit is most likely to have occurred that we can look at. So as you can see, about 23% of our kids who enter the system between age 12 and 14 end up aging out. And so we're interested in particular interventions for that age group, since they seem to be a group that has a high risk for this very negative outcome. The next focus area is about adoptions and making sure that we find more adoptive families and do so quickly for the kids who need them. So this is a snapshot of our kids today who are in permanent custody. Looking back for the last 3 years to give you a sense of who they are. And we have about 600 kids each year who are in permanent custody. As you can tell by those orange bars toward the right of each year and the blue bars all the way to the left, they are concentrated in little kids under 5 and then in big kids. That orange bar are 16 to 18-year-olds. And again, we just saw a bunch of those kids in the last couple of slides. So again, we want to see all of these children find an adoptive family if we can. We really want to shrink the numbers of kids who wait too long for this family to happen. Another look at our adoption situation. The federal measure that we are held accountable for is that we have 36% of our kids exiting to adoption within 24 months of their initial custody. So from the day they came into care until that adoption, we're supposed to get a little more than a third of those kids into a permanent adoptive family within 24 months. As you can see, we are currently sitting at between 15 and 18% in recent years. We've got a ways to go. So this chart shows you that 137 kids were adopted, but it took much longer than we would like. And so there's a lot of opportunity there for improvement. Okay. And last but not least, I want to show you a little snapshot that illustrates the situation with regard to children placed with their relatives. We have experienced, this goes from 04 to 12, we've experienced a steady decline in the use of relatives as caregivers since about the middle of 05, when about 40% of our new kids coming into care were placed with relatives. And today, just over 20% of new placements are going to live with their relatives. A lot of reasons, a lot of speculation. Some of them make sense to you, some might not, but as you can imagine, there have been explanations having to do with, have we exhausted all the relatives in Cuyahoga County? I don't think so. Although I know we've exhausted some of them. We have had changes in state regulations regarding what is required to approve of a relative for placement. There are lots of other relatives, by the way, who become licensed foster parents. That's not who I'm talking about here, and care for their relatives. These are those who do not. And it's gotten tougher, frankly, to waive certain requirements that we must meet in order to authorize a relative to take care of kids. And I will tell you that this is not a small problem. If you think about our community, if you think about our African American community and the overrepresentation of African American families in the prison system, and then you think about relatives trying to take care of kids who are being foreclosed sometimes in a very rigid way because of criminal histories, I think that takes care of some of the explaining here as well. And we have seen dips that correlate with the strengthening of state requirements, such as those. Beyond that, you know what? It is not an easy job sometimes to find extended families. When families come to us, there are often issues that they're facing, and they may not be real forthcoming about their extended family. So our workers have to work harder to build that family tree, particularly on the paternal side, where we don't do a nearly good enough job of finding all of the father's family and exploring them as potential caregivers for children. We do not support relative caregivers very well in the state of Ohio. Unless they become a licensed foster parent, the amount of financial support they get is very limited, largely limited to what they can get through TANF. And so that's another reason why it's sometimes hard. It also may be a factor that the worker who finds and authorizes and evaluates relatives is the same worker who manages the case. In other words, we don't have a separate worker, as we do in a foster care situation, who does that work. And so I think as caseloads get tougher for our frontline workers, I worry that sometimes they just feel they don't have the time to turn over every stone and find relatives. So I think it could be one of those, it could be others, who knows. But we want to see more relative care for our children. We think it's best for them, and so we'd like to do a lot better in this area. So now I want to give you just a few little snapshots of the potential cost savings if we were able to make a dent in those 5 areas. Again, these are just samples, and if anybody wants to know about the math, see me afterwards and I'll tell you where we came up with these. But just to give you a bit of an idea, in a ballpark way. The first example up there goes back to those children who exit to reunification and our efforts to try to make that happen in a more timely fashion. If we were able to achieve a reduction in the time spent in care by 3 months on average for the kids who go home, and we looked at a sample from about the past year to calculate this. We looked at their levels of care, their average per diem, those things. And we also backed out the 4E reimbursement for those of you who know about all that. The potential savings with our current population looks like $614,000 and change annually. If, on the other hand, we were able to double that reduction in time, down 6 months less, we're looking at, $1.2 million and change. So there is an opportunity there that's pretty big if we got better at getting children home safely faster. Second category here regarding kids who age out of care. If we look at that highest risk group, the 12 to 14-year-olds that I talked about, and if we were able to reduce their time in care by just 18 months, we would be looking at over $1 million annual savings for that population. I do want to say that some of those kids hopefully got adopted, and we also had some adoption subsidies for those kids. That hasn't been factored in. Nevertheless, that's very significant savings. If we looked at all of our kids at risk of aging out, not just that high-risk group, the potential savings go up to $3,252,800. Well, I said it wrong, but a lot of money. Less adoption subsidies again. Okay. Now, those long-staying children, the ones who stayed 10 years or longer, 81 children right now that we have in our custody. If we could reduce their time spent in care by 3 years, we're looking at $7,400,000 or so. A lot of money. And I just can't help but say, and it means a lot to what their lives are like, okay? Adoptions. If we could reduce the time that that child spends between termination of parental rights by the court and their placement in an adoptive family by 12 months for 200 of our kids out of those 600 in permanent custody who have been legally free already for 3 years, the potential savings there is over $2 million as well, minus any adoption subsidies. So again, these are big numbers for, I'm not going to say these are not challenging approaches, but not that many children. Finally, on the issue of placement with relatives, if we could double the use of relative or kinship care for our initial placements into care, we are looking at a potential savings of almost $2 million. This is based on the number of kids, or based on a presumption that they would spend about a year in care, is how we came up with that one. And as I said before, this one's a little hard for me to talk about cost savings because I know the relatives are not adequately fiscally supported in the state of Ohio. I can't resist pointing that out. On the other hand, kinship care, I believe, is very good for kids. So aside from the cost savings, there are many, many reasons why it would be better for our children, for more of them to be growing up with their relatives. I think that is it.
Original presentation, we did talk about presenting the cost template that we have included with the RFR. We're not gonna spend really any time on that cost template. I think the majority of folks here saw it in the previous 2 presentations. But let me just say that we are amending, or we are updating that cost template, so there'll be a new cost template up on the Western Reserve Plan website shortly. Caroline, I don't know if you would say anything more about the cost template at this point, or?
I think we're trying to keep it basic, something that's useful as opposed to cumbersome, and it can be modified as you wish from this original.
And we as I said, we did tape this morning's TA session, and we walked all the way through the cost template. So if you'd like to see that, if you weren't able to make it this morning and you want to see what the discussion was like around the cost template, you should be able to access that in the coming days. So we're not gonna pause there too much, if it's okay. And what we're gonna do is we're gonna just really get back to the presentation. Oops, excuse me. And I'm going to turn this over to Caroline to go to some evaluating and paying for outcomes.
Right. And I think before I do that, I just wanted to say thank you again to Pat for actually being willing to get up and talk a little bit about making this a little more real with DCFS data and potential populations there. I think this is one example of the types of data that you can access with county information to try to get a handle on when you're thinking about responding with target populations and where there could be an impact. And Pat, thank you so much for sharing that and the potential cost implications of that. One thing we wanted to touch on in a little more detail based on this morning was this whole notion of evaluation, because since they are performance-based contracts, it's going to be really important to define how you're measuring success and how you're designing evaluations. So providers can know, okay, what do I need to do to achieve success? And the county knows, okay, what am I looking for in order to initiate a payment? And so potential private investors also know what the expectations are here. So for us, as we think about moving forward and designing these projects, we believe that the #1 risk of failure in terms of implementing pay for success is tied to the possibility of non-rigorous evaluation. So we could go through the motions and we could set up a performance-based contract, but if it's only about people showing up, then the kids' lives haven't changed, the county's not actually saving money, and we've all spent a lot of time setting up a construct that actually isn't changing the way we do business. And so the evaluation really is critical to move from measuring outputs to actually really focusing on outcomes. And for that reason, we think it's really important to have independent third-party evaluators, or these validators. You want evaluation experts in the room as we're designing this project. So whether or not you consult with people as you're doing your responses, post RFR, there's definitely going to be evaluators in the room making sure that we're actually setting up a project where we can tell if the program's having an impact or not. And a big part of that, I know I mentioned this morning, is a focus on counterfactuals, which are really just measures of what the status quo is, what would have happened if we did nothing, or if we didn't have this preventative intervention. And so I think it'll be a learning curve, but post RFR we'll be focusing a lot on that, figuring out how do you actually quantify the real impact of a program and then what those savings could be. So a key piece of that is the administrative data. So we'll be, if there seem to be promising projects in child welfare, we'll be working with Pat and her team as well as the Office of Budget for the county to really get down into the details, figure out what administrative data exists so you can compare it not just for within the county system, but also look at the programs and potential interventions and be able to crosswalk that data with county data to see, okay, yeah, you were successful in this case, or to confirm that. And this is what the contracts are going to be built upon, the evaluation methodologies for outcomes. So it's a really key component. And to give just a little bit of a picture as to how this might play out, again, for your information, it's not something you need to delve into in deep detail with the RFR responses, but just so we can sort of see ahead and what would happen if we came to the table a little bit. There'll be the county will select a technical assistance provider or evaluator, this independent validator who has deep experience utilizing government administrative data and also measuring outcomes in human services. And a big part of this is going to be working again with DCFS or with other government entities and administrative data sources to look sort of in the past at what outcomes have been met and how have certain service providers been able to help achieve those, but also looking forward, what is the right structure for us to set up? So in Massachusetts, we're looking at a combination of using administrative data to create comparison groups within different cities, so you can compare sort of the results of, say, Cuyahoga County, which has one intervention, with a city that maybe not be getting an intervention, so comparing across cities, but also potentially creating comparison groups if you have a huge target population of 2,000 people and an intervention can only serve 1,000, you have sort of a naturally occurring comparison group if those individuals are at the same risk level. And so then we'll work together with all of the project parties post RFR to sort of get to this shared vision of what are the outcomes we're searching for and what's the best evaluation methodology to get there. So I don't think at any point already the county or DCFS, anybody really has a clear picture of these are the outcomes we want. We're looking for that feedback from you all during the RFR process and looking to collaborate on figuring out, well, what's the best outcome to reach for. And then this last step is really negotiating and establishing, so what's ambitious? We want to see more positive outcomes for these populations, but we also want to do what's realistic. We don't want to sign up for something, we want to have a success, we don't want to sign up for something that's guaranteed to fail. And there's a few ways that you can pay for success that are sort of emerging. And one way in terms of evaluation is this idea of paying per outcome. So the idea that if a project successfully redirected an individual away from incarceration, the county would say, okay, we see that, we're going to pay you X dollars for successfully redirecting that one individual. So that's payment per a particular outcome. And then some places, so that's what they're looking at doing in Massachusetts, is paying per individual success. In New York and in the United Kingdom, they're looking at more of a threshold level, paying for an overall reduction in a recidivism rate. So in New York City, they're looking at Rikers Island. They say, okay, we will repay investors if we see the recidivism rate drop by 5%, 10%, 15%, and they'll get different rates of payment there. And so that's sort of one, those are two different methodologies that could potentially come to the table post RFR. Not something that you guys need to worry about for the RFR responses, but just as you're thinking about, okay, what does success look like? It could be on a per individual basis. It could be on a sort of aggregate percentage basis as well. So there's two different ways to kind of think about it. But so that's just a little bit of an overview of how evaluation really plays an important role. I would say that in terms of what it means for the RFR responses, if you do have access to data, if you have had independent evaluations, please share that information with in your responses. I think it can only be helpful. And if you also have clear insight into maybe you don't have the data, but here's the piece of government, you don't have access to it right now, here are the pieces of government data that you would need to have access to in order to do this analysis, that's equally as helpful because it lets the county know, okay, we need to get those pieces in line and share that information, or we don't have that data. That's a big problem for this particular project. So any questions on that?
So you know, as I presented earlier, so this is where we are. We are now here into the technical assistance to responders, as well as just we have the RFR out, and it's going to close next month. And what we originally wanted to do was put a date in here and when we thought we would have deal construction together, and we're not going to be able to do that. We don't know how long it will take for us to construct our deals. I think our goal would be to have services up and running next year, and I think that's an achievable goal. But we will need to have we'll need to identify an investor. We'll have probably some work in that, but I think there is already interest locally, and we understand there may even be interest in national foundations, and then we'll need to go to council. And I do want to stress that point. This is not just because we've started this process, just because we may be able to find a deal that is worth presenting to an investor, and we may be able to find an investor willing to give some consideration to that. I need to be clear, nothing is approved until we have it go before council and we get their support. They're our partner in making the decisions of how we allocate county resources. And if we're talking about a multi-year contract with an end payoff, that's a complex contract that I'm not sure we've seen too many of those at council yet. So please understand that that'll be a pretty involved process in terms of getting council to understand and then ultimately to vote on that. We have been working with them all along. We had Sister Joanne Gross here earlier, so I think they're well aware of what our intentions are and what we're trying to accomplish. But I don't take their support or their questions lightly. I know they tend to have very good questions, and they need to see that everything is understood and kind of presented in a responsible way. So that really that brings us to the end of, I think, our discussions. I think we've had some great questions today. One last, I'll put it out there. Has everybody gotten a copy of the presentation? Does anybody need it? And we'll post that on the Western Reserve Plan. So if there are no other questions, I want to thank you all for giving us your time today, your flexibility for coming across the street. And we're going to wrap up, but we do have one other question.